Okay, this video is for spinal decompression training. We're going to start by showing you how to put the patient on the table, how to put the belt on, and the different steps that you need to get them in position so that they're ready for the decompression therapy, and then we'll come over and we'll talk about the settings. So we're going to have the patient go face down. We want this notch here to be right around their belly button. This is going to go across mostly their pelvis and lower back area. Go a little bit higher.
Yeah,
here.
bring the belt up.
Okay, here we go. Okay, so you're going to take the belt, and you're going to see that there's these straps here. And this is so that you can get good tension on the belt when you are trying to tighten the belt. So the belt is supposed to be secured very tightly. So you're going to pull and really pull through here so that the belt is nice and snug. And what you're going to do is you're going to take this large strap. Okay, it has a large buckle on it. You're going to take the other end and you're going to bring the buckle together. And then the goal is to get this ring to the center of the lower back and pelvic area. So you're really going to cinch down here. You're going to have to move this just a little bit. Okay, good. So that's a good, nice and tight. There's a second belt, which is a smaller belt. You're going to take the other end of that. You're going to loop the buckle through this ring, and you're going to latch it, and then you're going to also tighten that up. Nice and snug there. Okay. Now we're going to bring the table up to a level so that we can connect the harness to the instrument. You're going to see buttons here. It's the button that raises the table up, and then there's a button that raises the table down, or brings the table down. So we're going to bring the table up. Okay. Now we're going to connect the belt to the pulley system. So what you're going to do is you're going to take this middle strap here, okay, and you're going to take the little hook. The hook is going to come up. It's going to go underneath and through the metal ring. And then you'll see that there are two metal rings here. So you want to pull this bottom part nice and snug. You're going to take the pulley, and the pulley is going to come out and it's going to connect top down to the two rings. Okay. There's a mechanism over here. It's a little lever. You're going to turn that lever. That unlocks the table so the table can separate when doing the decompression. So let's go ahead and bring the phone over here. So the next thing we do is put the bolster underneath the ankles to make the patient more comfortable. So we're going to come over to the settings. Now you'll see the instrument here. These are the settings. This is the time of the decompression. Okay, this is the amount of hold and the reset here. So we're going to leave those at a constant, but we may change the time. And generally we're going to start patients out at about 12 minutes, 12 to 15 minutes. Now the other settings here are the settings of the amount of pull for the table and then the amount of tension when the pulley relaxes. We're going to start with 1/3 of the patient's body weight. So Dr. Mike weighs
190 pounds.
190 pounds. So 1/3 of that is going to be at about 65 pounds. So what we're going to do is we're going to press set. We're going to turn the dial. We're going to start at 65 pounds, or 64 I should say. We're going to set. We're going to leave the relaxed pull pressure at 30. Okay. We're going to go to the time. We're going to increase the time to 15 minutes. And now the patient's ready. Now there's another setting that's lumbar and cervical. We want to make sure this is on the lumbar setting. And then what we're going to do is we're going to push start, and the table will start. Now there's also a vibration button.